Talk about a very serious topic, not just in Trinidad and Tobago, but worldwide. Some of us, I'm sure every one of us, a family member, a friend, someone close to us, has unfortunately had cancer, succumbed to cancer at some stage with cancer, and I'm sure that every single one of us knows someone at that point. And to talk about it, I mean, we just heard just recently about the Mama Blackman passing away due to cancer, and I'm wondering, and we wonder, is it that it's increasing? We need to find out more about what's happening with cancer, especially with Trinidad and Tobago. So many people we hear every other day diagnosed with cancer. To talk to us some more about this morning, Patricia Tikasingh, patient counselor and patient navigator, to talk to us about cancer. Now, Patricia, I know we've got a program on Talk City 91.1, Cancer 101 at 11:15 every Thursday. And I know last year, trying to get in touch with you, because we do it via phone, you're from South, you were always busy, and that worried me. Simply because, no, you cannot be busy like this, which means that you have more patients to deal with, which means that it seems that more people are being diagnosed with some stage, some point of cancer in their lives. What is it like, really, in Trinidad and Tobago?
Well, I think, Ria, it might be a good thing and a bad thing. A good thing in that more and more persons are becoming more cancer aware. So we have more people seeking the screening that is available. And as a result, you have more diagnoses presenting themselves. We also, apart from that, quite apart from that, we do have increase in all the various cancer types. And this is an interesting factor. 20 years ago, you heard a lot about breast cancer and cervical cancer. You would have heard a little bit about lung cancer in men. Very rare would you have picked up on the prostate issues so many years ago. Today in Trinidad and Tobago, we can be hearing about so many varieties of cancers: prostate, breast, cervical, colorectal, lung cancer, pancreatic cancer, ovarian. It's just a humongous amount of varieties. People ask the question, why, how come can you get cancer in your ear or in your eye or in your sinuses? And the answer is yes.
Your face, because I've seen people with their mouth and thing, and you actually see the cancer eating out, tissue and everything.
You do have a lot of head and necks that are presenting as well. So what has happened in Trinidad and Tobago is, a few years ago, we just had the National Radiotherapy Center at St. James handling the cancer cases. About 5 years ago, with the onset of private care, both at Brian Lara and at Southern Medical in South, we also had Dr. Narayan Singh introducing clinics at the San Fernando General Hospital and outreach for cancer patients. But that in no way can truly handle the amount of cases that happen every year.
Is there any reason that we can give that this has increased? Because I think do we really know how cancer starts? Do we? And people are speculating. It's the food that we're eating. It's different from when we were younger, from what our grandparents had. It's all these pollutants in the air. What is it that's causing this increase?
Well, I think all of the above, our lifestyle choices. There are no standards. We have farmers that are growing crops. The main objectives are to get your crops to the market and have them sold. People, therefore, most persons, when they go, they're looking for the best looking vegetables and so on. I remember as a young girl, my grandmother saying to me, when you go to buy, look for the ones that have the holes in them. Means the insects are eating, or the worms are penetrating, meaning, of course, that it's of value. There aren't any chemicals. So it's a combination of things. Cancer starts from cells that are either affected by our lifestyle, that by the lifestyle choices we make. It may also be because of aging, because as you age, cells age. They may also not be able to function as they did when you were younger, and as a result you have cancer, the cells becoming mutated or changing, and the body's immune system has to be able to eliminate those cells in order that the body remain healthy. Sometimes these cells multiply much faster than the body is able to eliminate, and as a result, tumors or mass develops.
Now, how do we know? We hear so often people finding late stage 4. What are some of the signs, the symptoms that, can trigger off something's wrong?
So often we have talked about this.
Yeah.
Because the signs and symptoms are so close to just a normal headache or just a regular feeling of malaise, not feeling well. But if we pay attention to ourselves, and as we grow older, there are little signposts that we can pay attention to. The women, for example, I always advise, do your breast checks, your pap smears. These are things you must give yourself as a birthday present. Observe your period, for example, the regularity of it. Are you bleeding from any of the orifices in your body? If you see blood for any unusual reason, it's a cause for concern. If you are constantly tired, constantly ill, having headaches, nausea, vomiting, these are all reasons that you need to see the doctor. They may not be associated to cancer, but definitely any symptom that is persistent and presents itself needs to have attention. You can have persons, for example, who may identify lumps in their breast. And like the ostrich, they would stick their head in the sand and say, oh, that'll go away, or it's not cancer. Well, we cannot just tell that a lump is cancerous or not simply just by feeling it. We have to do something about it. So my advice is, of course, get yourself checked out. There are some cancers, unfortunately, that they are very good at hiding themselves, like ovarian, pancreatic, bile duct. Some of these are the very rare cancers that you actually cannot identify in the very early stages. And unfortunately, by the time they are diagnosed, they're already in the very advanced stages. So we just have to keep the awareness up, keep people being more alert about themselves. At this season, for example, my advice would be hydrate, protect yourself with sunscreen, try not to overdo the drinking, because our lifestyle choices contribute as well to what happens to our body.
Carnival is also a season, unfortunately, very sexual as well, STDs. How does that contribute or not, or affect or not cancer?
Well, once you've been, multiple partners are an immediate factor that would make you become prone to getting STDs. The human papillomavirus, of course, I think is the most famous one, which of course contributes to cervical cancer. But we have seen recently that it may also be a contributing factor to some of the oral cavity cancers. Okay, again, processing to the type of lifestyle choices we are making. I have seen HIV patients also being affected by cervical cancer. So HIV, of course, depresses the immune system. So any type of cancer can actually affect an HIV victim. So there we go, you know, this is why we try to promote single partnership, you know, staying healthy.
And basically, yes.
yeah.
And basically, get yourself checked. Any change in your body, Patricia, we say this every week on Talk City 91.1. Get yourself checked
Yes.
if there's any change at
Yes.
all that you're noticing in your body, in what's happening with your system. Thank you, Patricia, from taking the time coming down. I know you're coming from South. Patricia Tikasingh, patient counselor, an excellent one at that, and talking to us all about cancer here on Good Morning Trinidad and Tobago.